Hello guys, in this PPT we will discuss about the responsible conduct of research. First of all, what is research? Research means if you are just going to find anything new related to any subject or for the disease or for the animals, for the human beings and for any revolution which will be beneficial for your society, for the human beings, for the animals. So in further PPT, we will discuss what are the guidelines we have to follow during the research. Topic to be covered: Introduction to Ethics in Research. Ethics. Why is research ethics important? Ethical principles guiding research: dignity, consent, vulnerable persons, confidentiality and privacy, non-maleficence. These points I have discussed lots of time. So I'm just going to focus on a consent. There are three types of consent: verbal consent, written consent, and informed consent. Verbal consent, suppose this consent is mostly used when patient attendant or are not available at the particular time, or suppose a patient in a serious condition, so he or she is not able to give their consent. That condition, we can take opinion, or we can take any verbal approval or verbal permission for that particular person. That is called the verbal consent. Written consent, if we are just going to do any kind of treatment or surgery, so we can take a written approval of that particular person or from that person. So this is called the written consent. Informed consent. Informed consent means if we are just going to start any trial or research, or that we are hiring any patient or volunteers, so before hiring that particular person we have to inform regarding all the things which we will do in the particular trial. Means any benefits, harm, risk, everything. This is called the informed consent. So without consent we can't hire any person in a particular trial or in a research. Without their willingness we can't do anything. We can't force that particular person to participate in that particular trials. Introduction to Ethics in Research. You must accept the responsibility to behave ethically towards those who will be affected by your research. The ethics is the study of proper action. Research ethics concern the responsibility of researcher to be honest and respectful to all the individuals who may be affected by their research study or their report of the study and research. What is ethics? Ethics means principle of guiding decision making and the reconciling conflicting values. People may disagree on ethics because it is based on principles personal value system. What one person consider to be good or right may be considered bad or wrongly by the another person. Why is research ethics important? It is a reflection of the respect for those who take part in a research. It's ensured no unreasonable, unsafe, or thoughtless demand are made by the researcher. It's ensured the sufficient knowledge is shared by all the concerned. It is imposed a common standard in all the above respects. Ethical principle guiding the research: respect for human dignity, respect for free and informed consent, respect for vulnerable persons, respect for privacy and confidentiality, respect for justice and inclusiveness, balancing harm and benefits, minimizing harm and maximizing benefits. Dignity. Basis of ethical obligation: the selection and achievement of moral acceptable ends. The morally acceptable means to those ends protect the multiple and interdependent interests of the person, bodily, physiologically, and cultural integrity. Consent. Pre-assuming that the individual have capacity and right to make free and informed decision. In research, the dialogue process, right duties, and the requirement for free and informed consent by the research subject. Your research cannot proceed without consent. The consent must be maintained throughout the trial. Vulnerable population. Vulnerable population means the ethical obligation towards the vulnerable population. First, the damaged competence, damaged decision-making capacity, entitled to special protection, special procedure to protect their interest, entitlement to special protection against the abuse, exploitation, and discrimination. Entitlement means based on grounds of the human dignity and caring, solidarity, and the fairness. Confidentiality and privacy. Confidentiality should be maintained by the research team members or the medical team members, and the privacy is the rights of the patient. So we have to maintain the confidentiality and the privacy. Confidentiality should not be breached without any sense. If something is beneficial for the patient's sake or for the patient, so in that condition, we can breach the confidentiality for the better opinion or for the better treatment. Fundamental to the human dignity, standards protect the access or control, dissemination of the person information help to protect the mental, physiological, and dignity of the patient. Harm and benefits. So, in a clinical trial, we have to just think before starting the trial how do not harm the patient, and patient should be more and more benefited. The balance critical to the ethics of the human research. Foreseeable harm should not outweigh anticipated benefit. Harm benefit analysis affect the welfare and rights of the subject. So always minimize the risk and maximize the benefits. Justice and inclusiveness. That is the fairness and equity, procedural justice, application process, distributive justice, harm and benefits are the example. Null maleficence. Null maleficence means duty to avoid, prevent or minimize harm. No unnecessary risk of harm. Participation must be essential to archiving scientifically and the socially important aim that cannot be realized without the participation of the human subject, minimizing the harm required smallest number of human subjects that will ensure valid data. Beneficence. So, what is beneficence? The duty to benefit others, the duty to maximize the net benefits, produce benefits for subject themselves and other individuals, which is related to the research and which is under the research. The produce the benefits for society as a whole and for the advancement of knowledge, usually the primary benefits. Questions for the practices. Here I have given some questions related to the PPT for the practices. What is ethics in research? What is research ethics importance? What is the ethical principle guiding research with vulnerable population? What is confidentiality and privacy? What is the non-maleficence? First of all, we will know what is ethics. Ethics is a set of guidelines, or you can say that it is the part of section in a research who is just thinking about the human well-being or society well-being. Ethics means we have to follow some guidelines which will be beneficial for the society and the human beings. What is the research ethics important? In research, ethics is very important because we have to follow the some rules and regulations, and also we have to think about the benefits for the society and the patient. We have to maintain the confidentiality and privacy of the patient. We have to maintain the benefits of the patient, we have to reduce the risk for the patient. So without this, we can't follow all these things. Next one is, what is the ethical principle guiding the research? Ethical principles including, I have already given some idea in a second question. These points will include in ethical principle guiding research. Who is vulnerable population, or you can say that the person who is not able to do his or her things by own self. Like you can say that bounded person, or example, prisoners, pregnant women, mentally retarded, child who is less than 10 years, and the old age person who is more than the 60 years. This kind of categories comes under the vulnerable person. What is confidentiality and privacy? I have already talked about this confidentiality and privacy in a patient rights. Confidentiality should be maintained by the researcher team or the medical team members, and privacy is the rights of the patient. So we can't breach the confidentiality without the permission of the patient. Confidentiality should be only breached when we have to take the advice, better advice for the patient, for the treatment, or for the research. Without this, we can't reach it. Next, what is the non-maleficence? Non-maleficence means no harm. We do not harm the patient. We have to minimize the risk and maximize the benefits during the research. References. Here I have given some references. I have also taken some points from these references. If you want to just know in a briefly manner, ethics and clinical research, and what is the guideline of ethics, and how to maintain the ethics in a trial. So you can also choose, or you can also go through these references. If you have any query related to this PPT, you are welcome to ask any question. So I'm just going to end this PPT. Thank you.